Bismillahirrahmanirrahim. Today's video is about a type of supraventricular tachycardia, AVNRT, or AV nodal re-entry tachycardia. So first let me discuss the salient features of AVNRT. Basically it's a re-entry circuit because there is a fast pathway and a slow pathway within the AV node, so it's a re-entry tachycardia, and there are narrow QRS complexes. The rate is almost 140 to 180, and it can exceed up to 250 beats per minute. And one of the hallmark of AVNRT is usually P waves are not visible. Actually they are hidden within the QRS complex. One thing that should be noted that we cannot label it as not having a P wave or a P wave is absent. No, that's not the case. Actually the P wave is hidden, and it's hidden within the QRS complex, and that's why it's not visible. And sometimes P wave can be visible after the QRS complex, and mostly it's inverted in case of AVNRT, and it's called a retrograde P wave. However, these are the main salient features of the AVNRT or AV nodal re-entry tachycardia. Now coming to this ECG, let's calculate the heart rate. Actually, if we focus on the rhythm straight, so the heart rate is almost 215 beats per minute, and for calculation of axis we focus on lead 1 and AVF, and the axis is normal. There are narrow QRS complex. The definition of narrow QRS complex is less than 120 milliseconds. And if we try to locate the P waves are not visible, so most probably they are hidden within the QRS complex. The T waves are inverted in most of the leads. Look at lead 1, 2, 3, AVF in these leads, and also lead V4, V5 and V6, and even in these leads the T waves are inverted, and in lead V2 and V3 they are peaked. So one should not confuse these T waves with P waves. So these are all T waves, and there is also a non-specific ST segment depression, and this type of ST depression can be there in this much fast rate. So don't confuse it with ischemic changes. So that's all for now. Thank you very much.